Hi guys, this is Dr. Nadeem Ahmed of Sunshine Dental Solutions, and I'm going to show you a few examples of patients that came in. And these are typical patients in your practice, my practice, and even if you just work in a practice, you'll see these type of patients all the time. It's just a matter of recognizing and ascertaining and really getting insight into what the psyche of the patient is, what's the reason why, what's stopping them from doing treatment. And you'd be surprised, it's not always what you think it is, because a lot of times people say the number one objection may be financial, and we accept that oftentimes. Yes, okay, a person can't afford it, so we're not going to do anything. But I think I'm going to show you perhaps some cases which will really change your mind about whether finances are the constraint. So let's look at this first example. This is patient number one, and I just want to tell you, just as part of that insight into my consultation with you, is that you don't need to spend a lot of money on cameras, flashes, ring flashes. Some people really go to town on that, and God bless you if you've done that, not a problem. But if you're like me, you're a bread and butter dentist, you're not really going to spend a lot of money on equipment that is not going to be useful to you. So all my pictures, I'm going to do a little disclaimer, they're taken with a regular camera that I bought at a big box store. It was fairly inexpensive, and the taking great pictures, it just has to do with your abilities, and I can help you with those as well, so you don't have to break the bank to get good pictures. Because again, with me, it's all about being practical, but not only that, is so that you can actually get the work done in the patient's mouth without having to feel like, because you don't have this type of equipment or that type of equipment, that you're unable to do that. So let's talk about patient number one here. She came in, she actually didn't come to me because there was a problem with her smile, or if you look at her front teeth here, you can see she's got some fillings here, and I think she had told me that she had gone to a pharmacy and put in fillings by herself just to cover up the decay that was there. Now, again, that would lead you to assume that perhaps financial is an issue. Also, she had a missing tooth over here, and so again, everything's kind of making you feel like, and it's not to prejudge people, but you're going to naturally think the finances are an issue. So she actually came to me on a limited exam basis. She had pain on her right side, upper and lower. And in fact, these pictures I had taken at the second appointment, because in the first appointment, I had really taken care of her needs, and I had planted some seeds. And those seeds I'm going to talk to you about more in our one-on-one consultation, how we got to the point where a person who is doing their own fillings, hasn't gone to the dentist, only goes in pain, how she agreed to say, okay, let me see what my options are in terms of treatment, because really that's the point you want to get to. And one of the little clues to you is that patients today, they trust everybody, and they may not trust you as a dentist. Now, I know that's sad, but unfortunately, we've lost our trust with people because, again, if I look at this patient in terms of money or income, then of course, we're going to turn off a lot of our patients. So what we've got to look at is, what are the problems going on in the mouth, and then communicate that in a way that I can show you, so that the patient knows that you're on their side. And really, it's a definite, unbiased opinion about what can be done. So let's look a little bit further here. So we look in the mouth here. Obviously, we can see more issues emerging now. We've got a composite veneer that was done a while ago here on the lower that's starting to discolor and shrink. And, you just see a few more issues. And the main ones is right here in the front. And you can see how dark this tooth has gotten on the inside. This one's fairly dark right here. And even this one looks like it's developing some decay. So I'm going to show you what we did. There's that upper right area. And the first appointment, I did take out that tooth. And then, of course, I did see all of these other problems. And again, if you are just talking to patients, now, again, this is one of the very big tips I'm going to give you. And again, you don't need elaborate cameras, ring flashes, etc. If you're not taking photographs, then you're missing half of the plot, because here's the thing. When you tell a patient this on the toothache, the tooth on this side was similar to this side, broken down, almost gone, but this one was hurting and this one wasn't. So what you'll do is you'll say, well, Miss Patient number 1, you're having pain over here, but you notice you've got these teeth here as well. That need to be addressed. You may say need to be addressed. You may say, oh, they've got abscesses, they're necrotic. You can use all the words you want. But however, the patient currently is being driven by pain. So that's why I did address this tooth, but I did plant the seeds for this area in the initial appointment. Secondarily, I'm going to show you the lower arch. This is the lower right. That's the tooth I took out. So in fact, on the first visit, I took out 2 teeth, one on the upper right, one on the lower right. But my consultation with this patient did start off by me having a series of questions that helped her, the patient themselves, and myself ascertain what was the reason why, the rest of these teeth have not been fixed, why there's temporary fillings here in the front. And the patient may give you different things such as, I'm scared of dentists, I hate dentists, I don't have the money, I don't have insurance. Now, guys, I'm just reiterating what you probably hear every day. So again, I'm going to help you understand to handle these objections, to actually overcome them. Even the money issue, you will be shocked and stunned to find out these are not the cases where they walked in wanting all their teeth fixed. I understand we have those too. I'm talking about the people that just come in pain and they've neglected themselves in other locations. And what I'm going to give you is a set of tools that you can successfully overcome those constraints. And in fact, what you'll end up doing is you'll end up fixing or repairing the rest of the teeth. And the patient will be happy and you'll be happy. So let's go forward. Here's the front teeth here. And you can see we have quite large area of decay here in the central, the left central, in the right central. We've got these areas here. And again, there's not really any pain going on, but you can see the extent of the decay. She's got decay in most of these front teeth, which she's trying to repair here. So let's move forward. Again, there's going to be a lot more to this, folks, when I do talk to you one-on-one, how you go about creating value. Because again, this is an x-ray now. X-rays, they mean something to the patient, but they really mean more to us than it means to the patient. Okay, voila. Okay, I just threw it on you there. What did we do in this case? Okay, patient came in for an emergency. They were having pain. We did a consultation. We took some photographs. And guess what we ended up doing? We ended up fixing every tooth that was a problem. Now, what does that mean? We ended up, as you can see, whoa, there's missing teeth that have been replaced with implants. There's missing teeth over here, been replaced with implants. Now, this is that same patient that talked about can't afford it, don't have the time, don't have the money. We repaired the front teeth. And as you can see, we ended up crowning those teeth, and we ended up doing endo or root canals on those teeth, and even that front lower tooth. Now, what's going to be interesting is you're going to note, when you look at the occlusal scheme here, oh, I forgot to mention, we even took out wisdom teeth. Now, what's going to be interesting to you is I really love this about the approach that I have, because this one solitary amalgam filling, I left it there. I told the patient it looks fine, it's not leaking, it's so it's an option to replace it. So always keep the patient in control of their treatment. It seems obvious, but you're going to realize when you think about your case presentations and when you're presenting work to patients, you're always presenting it as a need or something they should do or something bad's going to happen if they don't do it. These people, I want you to take a different approach, and you'll find you'll end up doing what I've been doing for decades now, where the patient goes from doing nothing for so many years to fixing their upper teeth. And here, again, I did place an implant here. I placed 2 implants here. I did remove the wisdom teeth. We filled cavities in the back, and we ended up making the front teeth fabulous. On the lower, if you take a look here, on this side, I did end up leaving that wisdom tooth there. And on this one, I ended up putting an implant here as well. And of course, fixing that lower veneer. So this is highlights to you a person, and again, we've got one lonely silver filling down here. Now that wasn't the need though. And again, in some people, it'll be like, doc, we should get rid of that filling. It looks ugly. In this patient, that wasn't real big concern to the patient. She was more worried about her health. She was more worried about function and aesthetics in the end, and she was willing to pay for it. So people will always be willing to pay for something they want. Docs, you've done it all the time. Something you want, that piece of equipment, that vehicle, that house, whatever you're talking about, your kids, some presents for your kids, for your wife, for your husbands, for your significant others. You always find a way to pay for wants. You don't always pay for needs. And this is one thing you got to understand. And once you start applying that to your patients, you will find that they will end up spending large amounts of money. Now, this patient spent, maybe 25,000. I've got the exact number. But that was off a limited exam where the patient was scared, done her own fillings, and never had gone to the dentist other than for an emergency. So here we are, just showing you the x-rays. I did end up taking that lower right molar out, and I replaced it with an implant, and I restored it. And of course, I did all of the dentistry here. I placed the implants, I took out the teeth. And again, I'm going to share that with you. If you're on the fence about how you do it, what you should do, I'm going to help you navigate that to give you more confidence. And also, really avoid those pitfalls of dentistry that make people nervous and turn people off procedures, because maybe you get a little bit over your head. But this particular case is actually simple. And I'm going to use the word simple with a caveat. It's simple if you know how to complete it. And really, every dentist has the basic skills to complete this particular case. On the upper right, where I removed that tooth, again, I ended up placing an implant there. I ended up restoring that implant, and I did this myself. And, again, we got a fabulous result here, and the patient paid for all of the treatment happily. On the upper left of the patient, we had those true premolars that were breaking down. I removed them. I actually placed the implants right where the premolars were at, and I restored it on top. And again, you can tell me your cases are more ideal. You can do better dentistry. I agree with you. I agree with you. I agree with you. But again, if we're just talking about doing great dentistry versus actually, doing it, this is where I come in. Because again, if you have the skill set, but you're not actually using your skill set, then it's really not helping you in your practice. So again, here we place these implants. Here's the front teeth. Now, again, there was a lot of decay in those front teeth. We ended up doing root canals. We ended up putting the posts in there, and I ended up doing crowns on those front teeth. And those are actually bonded crowns. And something I used to do a lot in the past, I may have used different materials, but that's the beauty of dentistry. You can use whatever materials you want. I'm not going to show you symptoms that demand certain types of restorations or certain types of procedures. You're going to be able to use your whatever is in your armamentarium to do these types of cases. Now, let's talk about patient 2 real quick. This is a case, a person comes in, and you can obviously see the person's got dentures, upper and lower. And here we're going to talk a little bit differently about this case, because this patient was actually quite nasty and aggressive with me, just coming in and arms crossed, looking the other way. It was very hard to engage this person. But he wanted his front teeth repaired on his denture. So he said, that's all I want to do. Okay, you've seen the crack now. How did we end up just not repairing his front teeth? How did we end up doing fixed lower crowns and bridges? How did we end up restoring his vertical? His vertical was, I hate to say it was more than 4 millimeters off, but I can show you ways of ascertaining the actual vertical and what's going to be harmonious with their TMJ, with their muscles, so that they don't develop symptoms, or you don't have a problem with their bite. Now, here again, we ended up restoring all of the lower teeth, and we kept the teeth. We didn't say, oh, yeah, your teeth are really bad, it's going to be expensive. Prejudge the patient. Let's use some very specific words and questions with the patient. Let's hear the answer, and then you're going to decide, well, listen, sir, let me take a few photographs. And let me show you what I see. And in terms of what I see is this is what we see. Of course, you're seeing the after result, but we're going to imagine sometimes with the patient, what's going to happen is these teeth are worn down asymmetrically. And again, when you use the word asymmetrically, or you just talking to the patient without a photograph, my dear doctors, it is much more difficult explaining the asymmetry of this smile without a photograph. Even if you took a mirror and gave it to the patient, they have great difficulty seeing what you're seeing. So I simply use a photograph, and I say that the teeth used to be longer, now they're shorter, but then this one's longer, this one's shorter, and this one's really short. So it would be really nice, rather than just make a new denture, to talk to the patient about how we can make the vertical or the size of the teeth correct. And you probably heard it so many times, oh, I don't want horse teeth. And I'm like, you know what? I said, guess what we're going to do? We're going to actually make the teeth. We're going to have you look at them before you even put them in your mouth. Of course, we can do that with dentures, but there's going to be a little secret there too. We can do that with fixed work as well. So if we're doing crowns and bridges, we can decide on the exact vertical height of those teeth, how the bite's going to be, even before we do it in the mouth. And again, these processes are not going to cost you an arm and a leg. They're not going to take a lot of your time, because what's going to happen is the payback in investment in time, which actually is not going to be as much as you think in terms of time, because you have to be kind of pointed and very specific with the questions, and the answers that you receive are gonna direct you in terms of what you're going to do. But I'm going to be helping you to navigate these type of cases. So this type of case where it was just a upper denture, it was a limited exam, it went to full mouth rehabilitation. Yes, we made another denture on top, but again, we planted the seeds, because again, with this patient, I'm going to let him know what the options are on the top. But on the lower, we achieved all fixed restorations on the lower. We were able to restore the vertical height back to ideal. And of course, he's functioning better. But I would describe it like this. Sometimes when you have a new set of dentures, it's going to feel weird because they're new. They are going to be different. I use a lot of fricative and sibilant consonants, F and V, S and C. As you all know who do dentures all day long, there's very, very easy ways of ascertaining verticals and finding out the exact position. So I'll be helping you with that, folks, so that you can become more confident in these type of cases. Let's look at this last case, patient number 3. Again, this gentleman, very professional gentleman. You wouldn't imagine that if you saw his teeth. You would think, okay, how did a person let his teeth go so far? And again, he came to me on a limited basis, and I could tell in his mouth, because I'm going to show you the after, but I want to show you exactly what he's had done. He's had some implants done. He had some implants up there. He's had some, dental work, crowns done in the past. But how does a person like this let themselves get to this point? It's because, again, they don't trust us, folks. As much as we want to say we're trustworthy docs, you got to earn the patient's trust. And the patient's trust is going to be earned by listening to what happened to them before. Like, it's quite simple. I'm going to share a tidbit with you. I noticed, sir, you've got an implant in the back there. And they'd be like, oh, yeah, I had that done. It was a worst experience. They'll either tell you a good experience or a bad experience. I noticed, sir, that your lower teeth are really worn out. And you may know the answer to the question, docs. Listen, don't ever assume. Find out why the patient has let it go like this. Because they'll give you the same reasons. Insurance, no money, no time. But there may be another reason. So you've got to let them extrapolate and elaborate somewhat on their reasons, and then they eventually will give you the reason. And what's going to shock you in terms of these last 3 patients is lack of trust. You just don't trust the dentist. So they haven't found a dentist they can trust. So I'm going to help you share. So how do these people go to 3, 4, 5 dentists, never develop trust? And how did the dentist let them walk out the door without developing the trust? Because they thought they did the best job they could. But actually, I can identify with you objectively what they missed. They completely missed it. So in this case too, folks, it's an example. The vertical is completely gone. The patient is a dental cripple over here, but he's functioning. He's functioning everything actually he can do. But I have to use my systems to create a value for completing this. And again, on this side, we did end up doing fixed restorations on the lower. We did end up restoring the vertical height. We did end up, removing those two lower teeth that were too far gone. But again, this was a process, my dear doctors, and this process is actually more simple than you think. And what it'll do is it'll change your life, because what it'll end up doing is, with cases like this and other cases, these patients have got families. They have people they care about, and they know the trauma and strife or financial hardships or whatever they've gone through in the past. The family knows it. When you fix these type of patients and you help them with their dental problems, you will have not one person, but the whole family. I have got hundreds of documented cases that I'm going to be sharing with you. I'm going to be sharing you specific cases that you may have in your office, and I can share with you and relate with you because I've had the same type of instance. It's just that what I'm going to do, perhaps not better than you, you're going to be better than me at it when you get through this, because you're going to recognize how to convert those patients who want to do little or no dentistry or are afraid of the dentistry to complete their full mouth rehabilitation. So today I want to thank you all, docs, for following me here. I'm Dr. Nadeem Ahmed, and I am representing Sunshine Dental Solutions. And remember, I'm here for you to help you in your clinical practice, in making you more confident in the cases that you're doing, in your communication skills with the patient. So, you, doc, you've got great clinical skill set. You just need to be able to connect with the patient and in a way that's going to want them to do work with you. And for those of you dentists who are new to dentistry, you've been practicing for less than 10 years and you're thinking, whoa, those were major cases. I'm going to share with you, and I'm actually going to get you to the point where you can actually do these cases without stressing out, without worrying about the same things that everybody's got you stressed out about. I'm going to actually de-stress you. I'm going to actually give you the solution so that you don't get into trouble. Thanks for watching. I'll see you online. You can go to my website, sunshinedentalsolutions.com. You can go to online social media or to my YouTube page. I'll see you in the next video.